Dr. Gregory Morris from the Ultimate Foot Store here on Talking Feet, discussing forefoot pain. And so a very common problem that comes to my office every day is people complain of pain to the front of the foot. And you have pain up here in the ball of the foot, up behind your toes. We call the metatarsal bones of the ball of the foot. There's a couple of things that can cause pain up there. We talked about previously, we call Morton's neuroma. It's a pinched nerve that occurs between the metatarsal bones, and I'll talk about that. The metatarsal bones are here, these long skinny bones. Oftentimes we get a stress fracture of those long metatarsal bones. And then the bones, especially as we get older, the padding on the ball of the foot gets thinner, so we can aggravate the metatarsal bones. We call it metatarsalgia, or these two little bones in here we call sesamoiditis. For sesamoiditis, you can refer to one of our earlier discussions on Talking Feet about sesamoiditis. And same with Morton's neuroma. Basically, it's a pinched nerve in the ball of the foot. Today I'm going to concentrate on metatarsalgia and stress fractures, which are very similar. They're both just putting too much stress on the ball of the foot. And so we walk, we stand and run, we put a lot of pressure across the ball of the foot, and we strain these metatarsal bones. So we can aggravate the ball of the foot, especially as we get older, the padding gets thinner and thinner. And once again, here in Hawaii, we go barefoot a lot on the hard floors, and it puts a lot of pressure on the bones, especially as the fat pad and the skin gets thinner. So I tell patients in the house, wear something nice and cushioned. So instead of these bony feet standing on the hard floors around the house, standing on some kind of nice cushioned slipper or sandal, especially our Ultimate Foot Store recovery slippers, nice good cushioning and padding, a little bit of arch support. Any kind of slipper or sandals, but a cushioning, a little padding, especially in the forefoot, really helps that metatarsal pain or ball of the foot pain. And then once again, wearing a nice, good thick walking shoe. The Hokas are a nice shoe because they have nice good extra cushion in their foot. They're also very stiff, so we don't put too much pressure on the metatarsal bones. And they have a little bit of rocker design to it, so it takes stress off the ball of the foot. So you're walking, you're not putting stress on those metatarsal bones or the metatarsal heads. And then once again, any type of shoe, you can always stick a little bit better arch support. So inside the shoe, you take the over-the-counter arch support out, and you put a new one in. And with our Ultimate Foot Store arch supports, you support the arch a little bit more, a little extra cushioning. We even have ones with a little metatarsal pad built into it, so it takes pressure off those metatarsal heads. So it's, again, the more you can kind of support the foot, take pressure off those metatarsal bones, it helps take the pressure off the ball of the foot, those metatarsal heads, and the stress fractures. Anti-inflammatory cream, the Voltaren gel or diclofenac gel, that often helps with the foot pain. You can rub that into your feet, and also taking anti-inflammatory medication. But the biggest thing when you have pain to the ball of the foot, whether it's metatarsalgia or a stress fracture or a sesamoiditis neuroma, it's wearing good shoes and padding in the house, not going barefoot, and then wearing good, sensible walking shoes, a little more cushioning and support, and listening to your body. If it's painful, then get off or decrease that activity. Once again, it's Dr. Gregory Morris here from Ultimate Foot Store on Talking Feet. Our next episode, we'd be discussing Achilles tendonitis and tears of the Achilles tendon.